time, uh, your mentor also does not have any idea. I will say with due all respect that we are not taught about the journal club during our residency, and most of MD or DNB students passed the course without a single journal club. This thing still is okay, but the problem starts when you are working in a academic institute and you do literature research for your intramural or extramural project, and you find a plethora of articles and you confused which article to choose. Or when you start your practice, some MR or company guy came to you and show their research that this product is work. So now it is your responsibility to judge the article that this drug really works or not. So I think all have this experience with this type of incident. So now let us move to the introduction to the journal club. Uh, so what is journal club? So first, the outline of the presentation, my outline of the presentation is how this journal club thing is started and why is it need of our in our specialty, and what are the different steps to present a journal club, and how to critically appraise this journal club. So journal club basically is an educational meeting in which a group of individuals discuss a published articles, providing a forum for a collective effort to keep up with the current literature. So how this journal club thing started? It is started back in 1853, 54 when James Paget started. It's like an informal meeting type of thing, and he described it like a self-elect of peoples making themselves into a kind of club, had a small room over a baker shop near the hospital gate where we could sit and read the journals. In 1877, Sir William Osler, father of modern medicine, started first formal journal club for undergraduate students at McMaster University. So this is how a journal club is started back in 1877. So why there is a need of such journal clubs? So first and foremost thing is to remain up to date. A journal club make you up to date to the what is new things going into the journal club.
मैं एग्जीक्यूटिव मेंबर थे तो आज तो मैंने मना कर दिया था कि पिछली
To critically judge the research article, and a journal club links the research to the clinical practice by encouraging critical review of current medical literature. It acts as a vehicle for the application of evidence-based medicine. So it basically promote evidence-based medicine, not eminence-based medicine. या जो मैंने कह दिया वही चलेगा, या जो मेरे गुरु ने सिखाया वही चलेगा. So it basically change your practice, and it's allow academic debate and networking between your colleagues, and helps train you to develop critical appraisal skills. So what are the benefits of doing a journal club? So having a journal club is the most important, as so many articles published daily in PubMed, Google Scholar, whatever you go, there's a plethora of articles published in medical literature. One should know how to read an article and what to read from this plethora of articles, and where to read, where you get these standard articles. Okay, so we are living in the, as you all know, we are living in the era of infodemic. If you do not know how to interpret an article, you will be fooled. Okay, I remember when I was senior resident at AIMS Jodhpur, I presented a network meta-analysis. Believe me, it was my worst journal club ever, because later I found that is meta-analysis should not be present in a journal club. So you must know how to navigate in the minefield of medical literature. So there are various benefits that earlier told. It increase your it create your critical appraisal skills. Journal club makes participant keep abreast of current medical literature. It increases your research literacy and promote your evidence-based medicine practice. Interview skills are developed. Academic debates are stimulated, and it's improve your reading habits. It improves your knowledge. Intra-department social and professional networking take place through the journal club. And publications are generated. Obviously, if you doing a regular journal club, you do further research and you also write letter to the editor on that paper also. So there are various benefit of doing a journal club. So what is the ultimate goal of doing a journal club? Ultimate goal of doing a journal club is making a postgraduate or any medical professional a research critic. What research critic do? He or she evaluate research from for utilization in clinical practice. Not simply reading of a research paper or just reading the summary. A research critic debate on that paper, analyze that paper and understand its 360-degree implication and its outcomes. So the overall goal of the research critic is to formulate a journal evaluation of merits of a study and evaluates its applicability to the clinical practice. A research critic goes beyond a review or summary of a study. Just doing, just studying the summary of a study or just seeing the some new things are coming in the market is not a critical appraisal. A research critic carefully appraises a study's strength and limitations. And a research critic also do objective assessment of a study's validity and significance using various checklists available on the internet for assessing the quality of the study or quality of that article. So what are the different steps to present a journal club? First and foremost step and most first is the selection of the article. I will discuss it later about the selection, how we are going to choose the appropriate article. After selection, you have to take approval from your mentor and then disseminate journal club group, your colleagues, prior to the journal club, at least 2 to 3 days before. And then prepare your PowerPoint presentation, like what is the title of this article, authors, abstract, introduction, material, methods, results, and discussion. And finally, you have to critically appraise that article. So question come into the mind, what to present in journal club. So any original research article should be presented in a journal club. If it is randomized control trial, that is best, but never present a review article, systemic review or meta-analysis or case report in a journal club because they does not have any methodology. So how we are going to choose the journal club article? So first,
You are not audible, Rambeer.
I am not audible. From which slide, sir?
Now it's audible. Continue.
Okay. Someone make me muted. I'm audible now, sir?
Audible. Continue.
Yes, sir.
Yes, you're audible.
So how we are going to choose the journal club article? So first we have to choose a good standard journal. How you are going to choose a good journal? A good journal have a high impact factor and have high rejection rate. And look at the name of the institution. As a rule, the good paper tends to come from the good institution and at the author's name. Also, you have to look at the author's name. For example, like in pain medicine, Manchikanti, Prithviraj, Philip Pang, they are stalwart. If you see their name in paper, it's obviously a high quality paper. And if that paper have some grant from like ICMR or other granting agency, because these paper go very highly scrutinized by these ICMR like other agencies. So you can select that paper also, and a paper accepted for podium presentation at international conference also have, you can select that article also. So these are the basic criteria to choose a journal club articles. And there are various journal available in the market, but you have to choose good journals. Like if we are talk about pain medicine, there are various journal like pain physician, pain research, pain reports. They are very high impact journal. So try to uh, take article from these journals. So how we are going to assess a research paper? Assessing a research article is an art that postgraduate should learn. So what is the most important part of a research article is abstract. Before going to the introduction, material, method, and other things of the main body of the article, first a research critic should clearly read the abstract because it is very important part of the paper, because a good abstract conveys the gist of the research paper. What was the research question? How was the study plan to address the question? And what was observed? And what all was concluded from the observations? And finally, was the research question answered in the conclusion and result section? And then you have to read the introduction. Introduction should be able to convey the research question, the objective of the research question, and hypothesis. And material method should be vivid, reproducible, and clear. And observation of the study should be stated in an unbiased manner, and there should be no over interpretation of the results. In my opinion, try to avoid discussing the statistics in the journal club because it confuses the audience. So try to avoid the statistics. And discussion is the main part then after the methodology. So it is the discussion is the vital for the journal club because it is usually provide fodder for the discussion. So this is the critical appraisal skill program CASP checklist. It is freely available. You can download it and you can apply based on your study design, either it is descriptive or RCT or whatever study. So you can check the quality of study by applying this critical appraisal checklist. So this is from the AIMS Delhi, how they make a roster of journal club. Usually they select a journal from last 6 to 8 months, and the fellow should have to select from that journal the article. So the roster should be like this. So in conclusion, a journal club serves three purposes. First is it teaches and develops critical appraisal skills. It increases exposure to the rapidly evolving medical literature and help in informed clinical practice. So it facilitates better knowledge and literature awareness through the group discussion with peers and provide a unique opportunity to promote interest in research while learning from the experts about knowledge gaps in the literature and future research questions. At the end, I will say there is a myth that to present a journal club, it's required in-depth knowledge.
Thank you, Dr.
That is the
Rambeer.
art methodology and discussion that is discussed. Yes, sir. All you need to have is the compassion. That's all. Thank you all. Thank you, sir.
Thank you, Dr. Rambeer, for excellent presentation. This presentation gave a good insight to how to select a paper from a good journal, a reputed journal, and we should select mainly the randomized controlled trials which has been published in a good journals. That is the summary which I have learned from this presentation.